So a lot of times people bring in simulate participants and they're really not sure how to explain the role, especially in the past if they haven't had it in their program or they're not familiar with simulate participants, they're not sure how to explain what they're going to be doing. So I'm going to break it up into theater people and then healthcare providers, and that's usually the easiest way of how to get buy-in for them to be your simulate participants. With theater, they're going to come in and you just need to explain to them that they're going to be doing a lot of improv. It's going to be applied theater, which basically means anything that's off the stage. So they're going to be doing applied theater in an improv setting. They're not going to have a script. They're not going to know what happens. They're just going to be trying it out and kind of taking what comes with it. You can explain that they're going to have a character, but they're just not going to have a script. The part that we explain to the healthcare providers, for our retired community, it's really about them giving back to the next generation. So they're coming in and playing the patient and giving feedback to kind of give back. For people who are wanting to go into the healthcare field, this is really the only opportunity for them to be able to play the patient. A lot of them have never been hospitalized for an extended period of time. They don't really know what it's like to have that perspective. When they come in and they're able to play the patient, it really builds that empathy and that compassion and them just really understanding what it's like to be the patient. We've been doing healthcare theater now for 10 years at University of Delaware. We now have an attending physician who took healthcare theater a few years back. He says that he uses the skills that he learned of playing the patient every day in his practice because he feels like he can really anticipate what his patients are going to need because he's really been able to empathize with what it's like to play the patient. So that's really how we get a lot of buy-in. When we started, we had a lot more theater people and less healthcare, but now in our course, we have about 90% are healthcare providers and only about 10% are theater. It just goes to show that they really value being able to gain the perspective of the patient. Thank you so much for watching our video. If you're interested in learning more about being a simulate participant, we have training sessions here at University of Delaware. You're going to learn how to give feedback, the different kinds of standardization, and you'll get certified on each of the Avkin products. If you're interested in learning more about these training opportunities, contact your solutions consultant today. We'd love to see you here.